Hello, everyone, and welcome to the Functional Medicine Mastermind Pre-Summit Webinar Series. I'm Dr. Melissa Grill-Petersen, your host, and today I'm honored to bring to you the world-renowned expert in functional blood chemistry analysis. Dr. Dicken Weatherby is here with us, and he is the founder of Functional Blood Chemistry Software and FM Town. He is here today really to help you and I see if we really know what we think we know about functional blood chemistry. But get ready, because he's going to go through the what, the when, the how, and the why to everything that is functional blood chemistry, and he's going to really teach you and I how to set ourselves apart, how to really bring immense value to the patient, and ensure that we're getting the best in clinical outcomes, all with a simple, powerful tool called functional blood chemistry. So without any further ado, I'm going to turn it over to Dr. Dicken. I'm going to go quiet because it's all about him today and the material. So Dr. Dicken Weatherby, welcome to the summit. We're so excited to have you here.
Thank you so very much for that introduction. Really excited to be present at the Functional Medicine Mastermind Summit pre-event webinars. And so today's topic is functional blood chemistry analysis, or what I call FBCA, and this is your diagnostic advantage. You know, I know this sounds like a lofty statement, but I absolutely think it's true. If you can master the skill of functionally assessing your patient's blood test results, you will hold in your hand the key to open virtually any case that walks through your door. As Melissa said, my name is Dr. Dicken Weatherby. That's my beautiful mug up there. I received my naturopathic medical degree from the National College of Naturopathic Medicine in 1998. I'm board certified by the Oregon Board of Naturopathic Examiners. And I'm probably best known for my work in functional blood chemistry analysis and for FM Town and the Functional Diagnostic Medicine Training Program. You know, over the last 17 years, I've been using and teaching a system of diagnostic skills that I call functional blood chemistry analysis, one of, if not the most effective way to gather functional information from your patients. In 2003, I published this book. It has become sort of the seminal reference book on functional blood chemistry analysis, and I'm really gratified to know that thousands and thousands of copies of this book are being used every day in clinics and doctors' offices all over the world. And funnily enough, when I talk to docs on the phone who've had my book for a while, they say, you know, it's usually in pieces all over the floor. They use it so much. You know, and over the years, I've had the privilege of teaching seminars on blood testing all over the US, up in Canada, and in my home country, the United Kingdom and Europe. In 2012, after many years of work, I released my blood chemistry analysis software program. And this was designed to help analyze blood test results and generate what's called a functional health report. However, I soon realized that, you know, having an amazing tool like this, like a software program, will only be more effective and more powerful if combined with an in-depth online training. So I created blood chemistry. This is an online training program devoted to teaching blood chemistry analysis, providing you with the tools to be more effective in your clinics and practices. And as I was saying to Dr. Melissa, you know, over the years I've taught thousands of patients, so thousands of practitioners, how to do this work. And yet I'm constantly astounded when I meet new practitioners, new doctors, when I mention about the wealth of information that you can get from your patient's blood tests. They have sort of a glazed look in their face. So hopefully I'm going to change that today. So here's what you need to learn. A blood test is the most commonly ordered test on this planet. So I'm going to teach you what you need to learn about blood chemistry analysis so you can transition, like this says, to a more effective way of diagnosing. Hopefully you're not going to have to spend the thousands of hours that I did in order to be able to do this. But before I jump into that, I want to address something that many of you might be thinking, and that's, why should I bother? That's a good question. One of the things that happens in practice is that we get pretty comfortable with the way that we do things. And when we introduce something different, or a new idea, or a new technique, or a new tool, it can be quite time-consuming to learn this and introduce it to our patients and into our practice. But here's why you should bother with blood testing and learning how to do it from this functional perspective. More and more people are spending their own money seeing functional medicine practitioners and practitioners of complementary and alternative medicine, and most of those patients will test normal when using standard allopathic medical diagnostic tests. So if you don't have the skills to uncover the cause of their dysfunction, then the money that they might have to spend on functional medicine and complementary and alternative medicine is going to go to a practitioner who can, and not you. You must make an impression on them very quickly. One of the things that happens is patients come in with the internet, with everything that they're learning online. They come in really read up and knowledgeable about themselves. So in order to be able to have a dialogue and interaction with that person, we have to really make an impression on them very quickly. And we have to stand out as a practitioner who can make a difference and not just repeat everything that they've already read on the internet. You must be able to attract patients and be able to offer the latest techniques and treatments, but you have to do it cost effectively. And I think that's where functional diagnosis and this whole functional blood chemistry analysis really thrives. So guess what tests you've probably had done? A blood test. Millions and millions and millions of blood tests are run every year. But guess what 99% of your patients are going to tell you when they mention this? Oh, I've already had a blood test done, and my doctor looked at it and told me that everything was normal. Well, one of the things to remember is that the majority of the patients who feel unwell will come out normal on a lot of the standard tests physicians are using. And clinical experience suggests that these people are by no means normal, and they're actually a far cry from being functionally optimal. So they may not yet have progressed to a known disease state, but they are what we call dysfunctional. And what I mean by that is that their physiological systems are no longer functioning the way that they evolved to function. So let's take a look at some of the typical functional problems people are presenting to their clinic with. So this is a list of just some of the symptoms of a functionally disturbed patient. So it's going to be common for you to have patients with fatigue, low energy, digestive disorders such as bloating, heartburn, constipation, gas. They're going to have allergies, reduced immunity, infertility, pain and inflammation, hormonal issues, sleep disturbances, anxiety or depression, and weight fluctuations, either losing weight or more commonly having a difficulty keeping the weight off. So these are the typical symptoms of a functional disturbance in the body. And as I just said, most of the time when patients present into clinic with this, they're not going to have any clinical findings. Their blood tests, their pathology reports, their physical exam to a certain extent are all going to appear within the normal range. However, with a functional analysis of a patient's blood test results, we can identify the cause of these functional disturbances before severe damage sets in, allowing you, the practitioner, to bring your patient's bodies back into a normal state of equilibrium. So how do we go about assessing patients who come in with these types of symptoms? Well, I believe one of the very, very best ways to do this is with functional blood chemistry analysis. So that begs the question, what is functional blood chemistry analysis? Well, the main focus is to provide you, the practitioner, with an organized system to assess the underlying cause of the many dysfunctions that your patients suffer from, using information gathered from a simple blood test. And with that information, you can better prepare and implement an individualized treatment protocol for your patient. One of the things to remember that functional blood chemistry analysis is patient-focused. It's not disease-focused. For instance, you're not necessarily treating a patient's rheumatoid arthritis. What we're doing in this methodology is assessing for the weaknesses and imbalances in the patient's physiology to try and understand why that patient has rheumatoid arthritis. You're going to discover and correct the underlying cause of a disease process or dysfunction so the body can in turn return to a state of health and wellness. This is the state that we were all born in, hopefully, a state of true health and wellness. And I really believe that functional blood chemistry analysis can do that. However, in order for a system like this to work in clinic, it has to be clinically effective, has to be easily implemented, have a high degree of patient compliance. Your patients are going to want to have to do this, and also be financially rewarding. It's got to be cost effective to the patient, and also allow you as a clinician to make your clinic work financially. Before I dive into functional blood chemistry analysis, there are a few things that I want to cover, and one of which is something that I've been working with for, gosh, the last 17 or 18 years, and this is the 4 essential questions. And these are 4 essential questions I believe that you should ask yourself about each and every patient you see. And then what I'm going to do is I'm going to introduce the different organ systems of the body, and these make up what I call the functional indices, or it's kind of like a functional hierarchy in our body. And this is going to allow us to be able to get to the root cause of the dysfunctions and bring the patients back to a state of health and wellness. So let's start by looking at these 4 essential questions. So the first question you should be asking yourself about each and every one of your patients is there a dysfunction in this patient? And it's that if a patient is sitting in your clinic, they probably have some kind of problem that they're wanting to be solved. Sadly, we don't often get patients that come into the office and go, you know what, I'm in a state of full optimal health. I would like you to help me maintain that. That would be a wonderful thing. Unfortunately, that's not the case for the majority of our patient visits. So the important part of this question is identifying the location of the dysfunction. Sometimes what a patient tells you in their symptoms, they may be expressing something about a certain area of the body, but if we back up with our knowledge of physiology and our knowledge of the functional presentations of the body, we might know that actually the root cause of that is lying not in a particular area, but in somewhere else. And I think blood chemistry analysis is really primed to help us answer that question. Second question, what are the sources or the causes of the dysfunction? And again, I think that blood testing really comes into its own in this section. It really allows you to uncover the true cause of a person's dysfunction, which allows you to put together a treatment protocol that's unique and individualized to the patient to help them treat that cause. You can also use the results of your blood chemistry analysis to identify which outsourced lab tests, what salivary hormone testing, whether they might need to do an organic acids, they might need to do a detox profile, they might need to do heavy metal assessments, they might even need to do further nutrient deficiency investigations, or they might need to do a stool analysis. With the results of a blood test, you can more effectively use those tests to help you get more information. This is a concept that I call gateway testing. And so blood chemistry analysis really, in my opinion, should be the very, very first test we do, just because the plethora of information it gives us. And then from there, we can go, wow, there's stuff going on. I think a really good use of your healthcare budget would be to do a stool analysis. Rather than the very first time the patient walks in and starts telling you their story and they walk out with over $2,000 worth of tests, why not use a blood test to be able to identify kind of where the sources or the causes of the dysfunction are, and then be able to kind of handpick which further tests you might want to do. Question number 3, what individualized treatments are needed? If you've studied with me or if you've done any of my training programs, I don't often talk a lot about treatment. And the reason is that I presume that a lot of you are in contact with a lot of the supplement companies that service our industry, and they give wonderful protocols and treatment methodologies. But I think the really important part of this question is this: individualized treatments. We have to be able to put together a protocol that is unique to that patient and unique to getting to the root cause of what they're dealing with. And so I'm very much a fan of individualized treatments. And then the fourth question is, when has function been restored? And over the last 17 years, I've had the real opportunity to talk to many, many practitioners all over the world. And one of the things that I'm absolutely amazed about is that practitioners don't ask themselves this question. You must know when your patients have reached a state of function so that you can graduate them from what I call condition care and move them into maintenance care. And unfortunately, many patients self-select when they are done, and usually this is determined by when they run out of money. So what's really underneath this question is that we must be prepared to retest. I'm amazed at the number of practitioners like that example I just gave you, where okay, the patient walks out with $2,000 or $3,000 worth of testing. I'm amazed when I ask them, they don't rerun those tests. They never rerun them again. So you have to rerun your test to make sure that the problem that you're trying to identify and treat, and whether that problem has been resolved. And oftentimes they just do these battery of tests, find out what needs to be treated, they'll treat it, and then they'll just go on whether or not the patient's symptoms have gotten better. And to me, I don't think that's really good medicine. So I think that the functional blood chemistry analysis as your entry-level diagnostic technique can be really, really helpful here, because, you know, it's going to be a lot cheaper to run a comprehensive blood profile that some of the labs that we work with, you can get them as cheap as $150. Let's say you run that initially and then you rerun it 6 to 8 weeks later with a treatment protocol. The patient's only going to be out of pocket $300. That's a lot cheaper than a lot of these blood tests and salivary hormones and all that kind of stuff. Now, don't get me wrong. I'm not putting them down. I'm just saying that in order to be really effective as clinicians, let's prioritize them and put them in a correct order. So take-home message is, when has function been restored? If we can use testing to help us do that, then I think that's really, really important. So those are the 4 questions we need to ask ourselves about each and every patient. And what I'm going to do in this next section is talk about a concept called the functional index. And this is something that I built into the software program, because really it's a great way to look at blood chemistry analysis, is to be able to gauge whether or not there is a significant dysfunction within a particular body system, rather than jumping straight and going, well, you've got hypochlorhydria or you've got liver detoxification. I think in some ways for the patient, it's very helpful union of their functional systems. And that's the software program is really geared towards that output. And then my training program is kind of tailoring on that as well. So we start out with 13 body systems. At the top of the list is the GI, and this is in somewhat of a functional order. And by that, I mean, in naturopathic medicine, we always like to start here at the top with the GI and then move into the liver and then blood sugar dysregulation and that type of thing. So I'm trying my best to give it in an organization that kind of makes sense. So we start with the GI, and this allows us to assess for the organs of digestion, absorption, mucosal barrier function. And so some of the conditions that are associated with an imbalance or a dysfunction in the gastrointestinal system are hypochlorhydria or low stomach acid, gastric inflammation and inflammation of the stomach, gastritis, everything from very mild gastritis all the way through to ulcer formations. We have parasitic imbalances, we have pancreatic insufficiency, we have dysbiosis, we have leaky gut syndrome. And so that gives you a sense of just each of these body systems has, for instance, the gallbladder. We have a spectrum of gallbladder disease, so to speak. Right from the very beginning, we start out with biliary insufficiency, moving into biliary stasis, and then biliary stasis moves slowly into the building of these little gallstones. And if that's not dealt with, the gallstones are going to grow, and eventually we get blockage and all of the complications that come from that. The liver, one of the primary things that we're looking at with the liver is liver inflammation. Steatosis is probably one of the major causes of that. And when we have liver inflammation, our liver enzymes go up. And so we need to be able to assess for fatty liver. And that goes hand in hand with looking at lipid panels and that type of thing. Blood sugar dysregulation, again, you don't suddenly wake up one morning as a type 2 diabetic. It is a progressive condition, starting out probably many years before with hypoglycemia and reactive hypoglycemia, where a body is trying to respond to a Western diet that is shoving so much sugar in their body that the body's systems for regulating that go into a little bit of overwhelm. So we move from a hypoglycemic into an insulin-resistive state, into metabolic syndrome, and full-blown type 2 diabetes. With the bones, we're assessing for calcium regulation, we're assessing for parathyroid function, we're assessing for vitamin D. Red blood cells are looking primarily at anemias. We can differentiate between iron deficiencies anemias, vitamin B12 deficiency, vitamin B6, copper deficiency, vitamin C deficiency. So a lot that we can tell about red blood cell function. In the adrenals, we have this dance between hyperadrenalism and hypoadrenalism, and there are some great tests that we can look at on the blood test to help us with that. And then the thyroid, we have everything from overt primary hypothyroidism, usually associated with some kind of autoimmune thyroiditis. Hashimoto's is probably the most common of that. And so by assessing for TSH levels and free T3 and free T4 and total T3 and total T4 and reverse T3, we can get a really amazing view of what's happening with the thyroid. Sex hormones, as long as we've got a needle in the arm, we might as well draw some blood and be able to test for levels of free testosterone, total testosterone, sex hormone binding globulin, progesterone, estradiol. It's not going to give you as much information as you would from a salivary panel, but like I said, if you're drawing the blood, you might as well get a snapshot of what's happening on the hormonal level. It can be really, really helpful for male patients that are going through a lot of issues. In fact, in a few minutes, I'm going to go through a case study where one of the primary things that we're looking at is hormone dysregulation. And then for the male patients, looking at the prostate, measuring PSA. Then we're looking in the immune system, that dance between immune insufficiency, where we've got someone whose white blood cell counts are low, their zinc levels are low, and we need to kind of boost their immune system so they can kind of more effectively deal with their environment and the things that they're exposed to. And then, of course, bacterial and viral infections, and that dance between an acute and versus a chronic. And then this next section is huge, the cardiovascular system. So most medical practitioners, MDs, allopathic physicians, when they look at the cardiovascular system through blood testing, they are primarily looking at cholesterol. They're looking at LDL, HDL, and total cholesterol and triglycerides to a certain extent. But in our system, we're looking at 14 to 15 independent clinical risk factors for cardiovascular risk. And each one of these, when they're out of balance, is enough for us to pay attention. So really, really exciting part of our work is look. Again, we have a way to be able to assess for kidney function that is not necessarily about waiting until full-blown kidney disease has appeared. System's not functioning properly. Let's work with it now before we have to deal with it. And this brings up something that I love to talk about, and it's something that Gray Graham, one of my very early teachers, he's from Biotics Research Northwest, he always used to talk about the nightmare of yet. In a lot of conditions, and blood sugar dysregulation is one of them, their blood glucose levels come back at like 101. It's not quite enough to give you a categorical, yes, you've got type 2 diabetes. So a lot of times they go, well, you don't have diabetes yet. Just look at your diet and just stop drinking the sodas and da-da-da-da, and we'll wait and we'll test it again in six months. So the nightmare of yet is, oh, you don't have it yet, let's wait until you have it and then we can treat it. That is a completely ridiculous approach. My sense is let's assess it long before it's a disease, and we have at our tools at our disposal an amazing array of nutritional supplementation, diet, lifestyle, exercise, things that we can do with patients so that they don't have to deal with these diseases, but we're dealing with them long before they manifest as that. Here are the 8 accessory systems that we take a look at. We can assess for acid-base balance, metabolic acidosis, metabolic alkalosis, and the dance between the two of them. We can look for inflammation in the body. We can look and see whether there is evidence of heavy metals. We can't categorically say, oh, you've got a mercury buildup. What we can say is, well, there's a pattern here that is explained if you have a heavy metal body burden. And we can say the same thing for toxicity too. And so this is kind of a gateway test, because if these come up really high, what I do is probably do, advanced panel to help rule out specific heavy metals. Lipid panels, very important to look at. Despite what I said about cholesterol and HDL and LDL, they are still important things to look at. And sometimes the lipid panel is the only group of elements on the blood test that have anything to do with the cardiovascular system. So again, this is like a nice little gateway test too, because if the lipid panel shows up as being a heavy body burden for the patient, then we can go back and go, I want you to do a Berkeley Heart Lab profile, or I need you to do apolipoproteins, or I need to look at some of the other ways of assessing for cardiovascular risk. Oxidative stress, allergies, and electrolytes kind of make up this 8 accessory systems. Then we have our nutrient indices, in much the same way as the functional indices. These are ways for us to be able to get a sense of whether or not there is a mineral imbalance in the body, whether or not there's a vitamin imbalance in the body. What's the state of hydration like? Because dehydration is a big, big problem for people. And then these last 3 are more about the deficiency states. The carbohydrate index is really about how is the body responding to a diet that's probably high in refined carbohydrates, our classic diet, or Western diet, not just Western American. The fat index, again, telling us about whether or not they're able to process fats effectively or efficiently. And then finally, the protein index too. A lot of times our patients are protein deficient, and that can lead to a lot of problems. And so the protein index can kind of give you a sense of whether or not that's going on. Are you reinventing the wheel? You know, when I first went into practice, I used to reinvent the wheel each and every time a patient came into the office. You know, I'd been through 4 years of training at National College. I felt like I had an incredible toolkit to treat a lot of these conditions the patients were suffering from. What I didn't really have great training was how to handle those patients that are coming in with those symptoms of being functionally disturbed. What I would do is I would sit and listen to the patient for about 45 minutes and then look hard at the copious notes I took and wonder, what do I do next? What physical exam should I do? Should I run a chemistry screen and a CBC? Did I ask all the right questions? What protocol am I going to use? And it took me a while to put together a system of evaluation that kind of took the guesswork out of my new and follow-up consults. And here's one of the first things that I do. You might want to take a piece of paper out here and write this down. One of the very first things I changed was that I ordered or had my patients do a blood test on each and every patient before they came into the office. So if a patient calls up for a new appointment, we schedule the appointment, but we also make sure that they have a blood test done first. So it's going to sound a bit odd, but I think it's something that if you, implement it into your practice, I think you're going to see great results from it. Patients might go say, I've already had a blood test done, or what if they don't need a blood test? So I'm going to be really, really blunt and straight to the point here. Every new patient that books an appointment in your office needs a blood test. And if that's the case, why not get it done before they come in so you already have an idea of what's going on with the patient prior to their first appointment? I've done patient consults over the phone. The only piece of information that I have is a blood test and also a nutritional assessment questionnaire. Those are the only 2 things that I have. And it's actually quite fun sometimes to stop the patient before they tell you and just say, listen, I'm going to tell you what I think is going on based upon the questionnaire you filled out and also the blood test results. And you can get pretty darn close, and they're very, very impressed with that. So once I started doing this, getting a blood test before the patient actually showed up for their appointment, I saw a shift in my office. Like a good naturopath, I was taught to take a thorough and exhaustive history in the first visit. The problem was that I didn't really have any idea what to do with all the information I collected. I soon identified a number of common problems that doctors are faced with. The first is you're spending too much time asking questions. The second is not knowing what to do with all the information that they gather. They've all got really nice notes, and they've got these thick questionnaires, and they've got these thick notes on their first office visit that sit at the back of the chart, and they never look at it again. So they never look at that initial history again. And here's the real clincher here, using symptoms as their primary means of tracking progress. So one of the very first things I did was I implemented a thorough health assessment questionnaire. The one I use is called the Nutritional Assessment Questionnaire. It's composed of 322 questions broken down into the foundational systems of the body. I gave this health appraisal questionnaire to every new patient in their new patient packet of info. It's one of the best symptom gathering tools I have found. And the NAQ, along with functional blood chemistry analysis, is kind of the 2-headed monster in the clinic. So this is what it allows you to do. It allows you to track symptoms over time. There's nothing better than doing what is called a history in motion. Like I said, a lot of practitioners collect a lot of information in that initial history, but they never look at it again. When you use a health appraisal questionnaire, It asks you or allows you to ask relevant history questions in an easy-to-use questionnaire and enables you to re-ask those questions at a later date so you can see if there's improvement. So we really need that. We need to be tracking symptoms over time. The second thing is it really encourages compliance. Haven't changed. Well, by using something like a health appraisal questionnaire, we can ask the questions, the patient gathers the information for the analysis, and you can sit down with them and point out that yes, your headaches have not completely resolved, but on your initial intake, you reported that you reported them as a 3. This is a severe symptom that occurs frequently, and on your next appraisal questionnaire, you said that they're a 1. They're a minor symptom and they're occurring rarely. So this patient is more likely to comply with your recommendations because you're showing them that there's improvement in their symptoms. I also require that my patients fill it out on a regular basis. I can see a patient's progress, substantiate the changes in their symptoms. And then finally, it allows us to really assess the symptom burden of a particular patient. So that's a little segue into the functional blood chemistry analysis. If any of you want to get a copy of that questionnaire, just drop me an email to support@bloodchemsoftware.com and we can get a copy of that to you. So now I'm going to kind of touch in on functional blood chemistry analysis. I can't emphasize this enough. This technique can make such a huge difference in your diagnostic skills. It's one of the most important functional diagnostic medicine tools for the identification of functional disorders and disease prevention. I think one of the things to remember is that the human blood is a walking library of information about the state of our patient's functional health. One of the things it does, it says where you are now. It kind of gives you an indication of what you've been doing that led you up to this point, and also gives you a sense of like a roadmap ahead. If you don't pay attention to what's going on now, here's what could happen. But if you pay attention and you start doing some basic treatments and doing some exercise and lifestyle changes and some supplementations and botanicals, here's what we can say is that those symptoms are going to disappear. You're going to move back towards a state of health and wellness. We can use targeted blood testing to help with chronic conditions such as oxidative stress, inflammation, digestive dysfunctions, all those things that we have just talked about. Another thing I love about blood testing, you get an objective proof of results. There's nothing more objective than having a needle shoved in your arm and blood taken out and being able to look at the results from that. It's going to give you a lot of confidence in dealing with difficult cases, diseases, and conditions. And it's going to help you validate your treatment recommendations. And also the thing I talked about earlier being gateway testing. But you know, one of the issues with traditional blood testing, and this is just a lab report that came back, one of the problems with traditional lab reports, if you could just take a look at this one here, is this provides absolutely no meaning. It's almost as if this has been designed to be deliberately obscure. So it's a long list of names here on the left, most of which the patients have never heard of. A lot of little acronyms like BUN, EGFR, ALT, AST, hemoglobin A1C. So the patient has no idea what they are. A list of numbers, a list of a little H here, meaning high or low, a reference range, and then some initials here. So there's absolutely no meaning imparted from this report to the patient. And the only meaning that they are massed and codified in these reports. Though these data can guide and direct our personal health journey, most of the meaning suggested by the data is lost. And as we can see, the issue is certainly not in the lack of data, but rather the absence of a tool powerful enough to tease out the meaning. Receiving a lab test result with some kind of notes written on it really doesn't extract the meaning. And oftentimes the patient's told, well, everything looks normal. But one of the problems is there is a huge problem with normal. On this slide kind of shows you about that. Lab data are tricky. Its meaning is derived by comparing it to normal values. So the first question we should ask ourselves is, how are normal values derived? Well, the conventional standard or normal reference range that we just saw on that slide previously are based on the Gaussian distribution of a bell curve, which says that 95% of the population are normal. 2.5% of the population are going to be above the reference range, and 2.5% are going to be below the reference range. So here's the kicker. The normal range is based on statistics and not whether a certain value represents good health or function. Normal ranges are designed to identify and diagnose disease states, tissue change, pathology. So when an allopathic physician reviews a blood test, their only concern is when a particular result is outside the normal range, because values outside of the normal range are designed to identify and diagnose disease and pathology. The other thing is that because it's based upon the statistical variation, normal ranges tend to change from year to year and also from place to place. A normal range on the west coast of the United States may be different than the normal range on the east coast. That makes no sense. We're the same people, really. If we're going to be having a range, let's make it the same. Why are people in California any different from the people in New Hampshire? So the problem is that the normal range really reflects an average population. And one of the things that we know, average populations are not healthy. They're not optimal ranges required to maintain and bring us back to a state of health and well-being. And that's why in my work I use functional optimal ranges. So the functional approach is oriented around changes in physiology and not pathology. So we use ranges that are based on optimal physiology, and we don't use the normal population. So what happens, this results in a slightly tighter range. So where this line here represents the normal range, this dotted line here represents the functional range. So we have a functional physiology. So that means that patients that are between the normal and the functionally optimal are functionally low. And the patients that are between the normal high and the functional optimal high are functionally high. So this results in a gray area. And this tells me that something's not right in the physiological systems that are associated with this element. So we can increase our ability to detect patients with changes in physiological functions. So we can look at things like what's happening in the body that's causing this, changes in physiological, biochemical, metabolic functioning. One of the other things that we do, and it's not on this slide, is that we look at patterns and trends between elements, as opposed to just looking at specific elements in isolation. You'll see when an allopathic physician goes through the test, they're looking at it element by element. They're not looking at how And this is one of the main things that makes functional analysis different than a standard analysis. One of the questions I get is, where do these optimal ranges come from? Well, many of them were normal ranges about 20 to 30 years ago. I also, there was a lot of information gathered basically what they were looking at was like, if we look at enough patients, are we able to uncover issues associated with cancer? Can we predict cancer long before it happens? Well, what ended up happening was they got an enormous amount of information that led them to some of the patterns that we look at, which are, you know, for hyperchlorhydria and renal insufficiency and things like that. I've studied incorporated ranges from a lot of practitioners in this field. I know one of them, Lynn August, Patricia Kane, Joseph Montante. I've also incorporated them into my clinical observations over the last 17 years. And also, it's an important to talk to old-time docs. I had the privilege of talking to some naturopathic physicians that were trained in the 50s and 60s, and they imparted a lot of their wisdom. So where do we start when we're doing blood testing? Well, I think the very first thing we have to do is we have to take the existing lab test and we have to look and see what's outside of the normal range. This is going to tell us about potential pathologies that could be present in your patient. Then we need to look for values outside the optimal or the physiological range. You can use a blood chemistry tracking form, and again, if you want a copy of that tracking form, just email me at support@bloodchem-software. These have the optimal ranges, and you can use a manual tracking form to enter results and see what's above or below the optimum range. And then once that's been done, we need to begin the analysis by looking for patterns among the elements. My book, Blood Testing, Blood Chemistry and CBC Analysis, you can get it from Amazon. All of the patterns in it. Also has a copy of the tracking form in the back as well. Or you can put the results into a software program like mine, and it's going to start making inferences between the various different elements. And then finally, once that's all been done, we have to do a report of findings presentations. So this is where you sit down and consult with your patient. To demonstrate all of this, I want to kind of go through a case study, because cases are a great way to kind of show the usual way of doing things and then also the secondary ways of doing things. So this is a 39-year-old male. He presented to clinic with complaints of low libido, gaining weight, especially around the abdomen, not sleeping well, catches colds every winter, muscle aches, and generally has low energy. So we did a blood test, and so let's go and see what the results are. So this first page is something that you've already seen. This is the first of 5 pages. And what I want to do is start out looking like many physicians do by reviewing the original blood test report. This was done by Quest. And so let's see how much information we can gather from this, just from this particular test. We're not going to do a functional analysis. We're just going to look and see how much information we can get that can kind of explain why this patient is dealing and suffering from these things. So this first 2 pages, the only thing is his bilirubin is high at 1.9. So that's elevated. Next page here, his direct bilirubin is also elevated, but nothing else on page 4. And on page 5, we have a low DHEA sulfate. Now, this was a lab test that I ordered, so most allopathic physicians on this type of patient are probably not even going to order that, so that's not even going to appear up. But his DHEA is low. So let's take a look. Out of all of those elements, 5 pages of testing that was done on this patient, only these 3 elements were out of value, out of range. So what does this tell us about this patient's condition? Everything else is normal. So I'm going to kind of pretend that I'm his sort of allopathic medical doctor. And believe me, I've got nothing against allopathic physicians. It's just I have a beef about some of the training that they went through. They're given these tools, but not really shown how to really get real information out of it. So an allopathic physician might say something like this. Your cholesterol and triglycerides look good. Homocysteine level looks good. No cardiovascular stuff. Kidneys look good. BUN and creatinine are normal. Electrolytes look good. Calcium, proteins, and globulins are all looking good. Liver enzymes are all normal, so nothing really wrong with your liver. We do see that your total bilirubin is high and the direct bilirubin is low. And what this is, bilirubin is formed from 2 types of bilirubin, one we call indirect and one that we call direct. And basically the liver takes this bilirubin and makes it water soluble. And we are seeing a high level of direct bilirubin. What I might want to do is to, are you having any pain in your right upper quadrant? And this would be a segue to potentially doing an abdominal exam, because one of the main reasons for direct or conjugated bilirubin is a blockage in the liver or gallbladder. So this might lead to an ultrasound if the physician is good enough. Going back to our allopathic physician here, glucose, insulin, hemoglobin all look good, so you're regulating your sugars well. Thyroid looks good. Testosterone all looks good for your age. CBC all looks good, no immune issues, no anemia, iron levels are where they should be, and the prostate is good. So the allopathic consultation was pretty much useless. So let's see if we can help this chap with a functional analysis. And what we did is we put the results of this blood test through my software program, and this generates what I call the functional health report. It's a comprehensive lab interpretation report that evaluates the unique biochemical patterns in your patient's body, provides evidence-based data for your diagnosis and treatment. So I'm going to look at that exact same case, but I'm going to look at it through the lens of my blood chemistry software and functional blood chemistry analysis. So hopefully you guys can see this. So just a little bit of background here. This is a 30-something page report. You can put your own logo at the top here. It pulls out some pertinent information about you, office phone number, office email address, gives the patient information when the test was run. Next page gives us a table of contents. And the first thing that we get is what's called a health improvement plan. And so it's kind of jumping to treatment right away. And what the health improvement plan does is it looks at all of the information on the report and creates unique customized recommendations to help bring the systems of the body back into balance. So we look at the first top 5 clinical conditions or dysfunctions and the top 3 nutrient deficiencies. The very first thing that came up was a pattern for biliary stasis and insufficiency. And the reason for this was that total cholesterol was above optimal, ALT was above optimal, bilirubin, direct bilirubin, and triglycerides were below optimal. So in the analysis came up that biliary stasis and insufficiency was something that needed to be treated. I'm using Biotics Research as one of the protocols in this software. Currently there's 10 supplement companies in there, and you can choose which one you want to use. And so it's giving us, excuse me. Sorry, I've got a frog in my throat there. It's giving us the various different nutrient supplements to be used in the protocol. The second condition was male testosterone deficiency. Remember that the allopathic said testosterone levels will look great, but when we get to looking at the blood test results, you can see that that's very, very far from being true. And so again, these are some of the protocols from Biotics. Increased cardiovascular disease risk. There was nothing that the allopath said anything about cardiovascular disease, yet from a functional perspective, his glucose was too high, his cholesterol was too high, his homocysteine was too high, his male estradiol was too high, his vitamin D was too low, and his free testosterone was too low. All of these are clinical risk factors for developing cardiovascular disease. So it'd be a good idea to put this guy on some cardiovascular protocols rather than wait until all of the independent clinical risk factors are present. And then also there's evidence of a viral infection. Lymphocytes were too high and the serum iron was relatively high. So dealing with some kind of immune issue here. And finally, we have metabolic syndrome kind of going hand in hand, I think, with the the cardiovascular risk issues. It's saying that because the cholesterol, DHEA was low and the cholesterol was high, there's a good chance that metabolic syndrome is present. Obviously, you need to measure this guy's blood pressure and see where that's going. But again, he's on the spectrum. Let's deal with it before it turns into full-blown type 2 diabetes. Nutrient issues, DHEA came up, so supplementation with some kind of DHEA would be important. Vitamin D came up. Vitamin D is so important for human health and human physiology. If it's low, it's a good idea to treat it. And also a zinc need tied in probably to some of the low libido that this guy is experiencing, some of the testosterone and sex hormone dysfunctions, and also the immune issues. So doing some zinc therapy would be really helpful. So that health improvement plan is kind of a really big plan. We also have a summary plan that you can run where it kind of summarizes everything, gives you a list of the protocols, what the top supplement would be, and then the dosage. And so that's kind of the protocol point. Now let's take a look at the blood test results. This is kind of where the software really comes into its own here. So this patient's only had one test done, so we can't really compare before and after. But if there was a previous test, it would be put here in this left-hand column, and we would give an indication of whether or not there's improvement with an up and down thumb. So just to give you an orientation here, within the software we have hyperlinks to my blood reference book that's built into the software, so you can very quickly and easily reference what's going on from within the software program itself. So we have the current value of the patient's results, optimum ranges, standard ranges, and units. We can freely convert between standard international units and the US units, so this is truly a global software program that can be used. So we can quite, he had 3 things wrong with him. And this little infographic says, well, actually there were 9 above the current range, optimal range, and 8 below the optimum range, and there was 1 that we could consider to be alarm high. So this guy's got some issues going on. One of the other things that we built into this were a lot of the functional ratios, albumin globulin, calcium albumin, calcium phosphorus ratios can be really, really helpful for kind of uncovering some of the functional issues that our patients are dealing with. So you can just run this report and sit down and do a patient consult if you're good enough, and you can start looking at the interrelationships between elements. Or you can rely on the software to do the analysis for you. So there's our bilirubin issues. What you notice that they only gave us the total and the direct, but because the total bilirubin is the sum of direct and indirect, the software program will calculate what the indirect is, thus giving us a little bit more meaning. So all of these are out of value. There's something definitely going on with this person's gallbladder. Here's the hormones. When that guy said, oh, everything looks normal with your hormones, everything looks not so good. We've got a really elevated estradiol. We've got a low testosterone. I'm thinking that this guy's abdominal obesity is probably contributing to testosterone when it's produced being primarily pushed into estradiol and not into free testosterone. And so we need to help break that cycle. One of the best ways of doing that is with zinc. But, really working with this guy's sex hormone issues will help with a lot of those issues that he came with. The low libido, the fatigue, the immune issues that he was having. Functional index report. So these are the functional systems of the body. You can see here that the gallbladder function index is number 1. The gallbladder function index tells us there's something really not quite right within the gallbladder system. Sex hormone index, again, something off with his testosterone probably and estradiol and that type of thing. Something going on. Sorry, my mouth's very dry. Something going on with the immune system. We saw it in the health improvement plan as a viral issue, but that's enough to push this index up to 76%. Something going on with the thyroid, acid base is a little bit out of balance, and then we have the cardiovascular risk index and blood sugar index. Below here gives us a written report, what the rationale was, what elements are considered in order to come up with this calculation. And so anything above 50% gets a written assessment underneath. Sorry to kind of be crazy on your eyes as I'm scrolling through this. And then the nutrient indices. So there's definitely something going on in the vitamins area. He's got 100% likelihood of dysfunction in that area. And then all the others appear to be kind of within the normal range. The fat index is probably because that cholesterol was a little bit elevated and the triglycerides were a little bit low. And there's the nutrient deficiencies. There's a zinc need, a DHEA need, a vitamin D need, thiamine need. So this would be sort of a B complex, vitamin B12 and folate, 58%. We obviously didn't measure vitamin B12 or folate, but even that is, without those there, that's a little bit too high. And so, doing some kind of B12 supplementation might not be a bad idea, especially the guy's, claiming that he has a lot of fatigue. So again, the rationale here. And then we get the clinical dysfunctions report. This kind of drills down into those different organ systems. And it really is telling us that the gallbladder thing that this person's dealing with is probably biliary insufficiency. There's definitely a testosterone deficiency going on. The immune issue is a viral one. The blood sugar index was indicating a metabolic syndrome. The issue with the gallbladder is such that even the pattern for biliary obstruction is going up. So what I would do is, the first thing if I saw this would be get the guy out on the table, do a thorough abdominal exam, making sure that you're being very gentle as you palpate over the gallbladder. But this might be a case where you would refer out to an ultrasound to make sure that there isn't some kind of stone formation happening. So this is kind of an indication of what's top and then coming all the way down to less likely things. And then finally, again, a little write-up that they have biliary insufficiency and stasis. And then finally, one of the things I wanted to do was to give you a sense of what further testing needed to be done. And so it does an evaluation and kind of gives us a sense, well, the zinc deficiency was quite bad, so I think that either you want to treat presumptively or you might want to do a zinc taste test in the office or check white blood cell zinc or red blood cell zinc levels. And then the male hormone dysfunction is bad enough that you might want to do a male hormone salivary test. Gives you more information about the type and the severity of the issue. And then there's a disclaimer. So that's the blood test that we did on the patient. So let's, if we go back here quickly. So this is what he's coming in with. So what we saw was that the main blood test report didn't really give us very much that we can help with this guy. But now that we've looked at it through the functional lens, we can sort of explain, yeah, the low libido and the gaining weight, especially around the abdomen, probably has a lot to do with this testosterone imbalance. Not sleeping very well, catching colds every winter. His immune system's challenged. He's got low energy. There's definitely some things going on with his blood sugar regulation. We need to work with his diet and that type of thing. So way, way more value, way, way more meaning, way more information is given to that patient that's actually meaningful to them and really allows them to walk out with a 30 to 35 page report that gives them some really good information. So just kind of summarizing here, the main role of FDCA in the clinic: prevention of disease and dysfunction, early detection of disease and dysfunction, I think is probably one of the most important pieces, and giving you advanced patient-specific information. So this would be lifestyle modification, therapeutic exercise, structural support, diet, nutritional support, stress reduction, botanical medicine, homeopathy, whatever it is that you're treating. Once you've kind of got the list of what you need to work on, you can then move in and start treating it the way that you want to. And in talking about treatment, this is just my own personal thoughts about treatment. It must address the underlying cause, and that's the cause that's elucidated by the blood testing. It must respect the biochemical individuality. It must focus on restoring physiological function, and ultimately cause no harm to the patient. What's the benefit to the patient? Improved quality of health, because you're focused on them and not their disease. Reduced costs, you're no longer spending thousands of dollars of their money on testing. You're reducing their suffering because you can identify what's going on with them long before they emerge as pain and inflammation. You increase the likelihood of a cure, and ultimately you're reducing the incidence of premature aging, mortality, and morbidity in your patients. So the successful implementation of functional blood chemistry requires knowledge. Obviously, there's a lot of information there. You have to have the knowledge in order to be able to put a thinking process to work for you. So we've covered some of that. Requires a system. I'm very much a systems-oriented person. Experience in the business world has shown that a business that operates using a systems approach is going to be far more successful. Nowhere is this more articulately expressed than in the E-Myth Revisited by Michael Gerber. A systems approach to the business of healing and medicine will allow you to work on your business rather than focusing all of the time kind of working in your business. So applying the knowledge in the system is a key to success. And then finally, it requires tools. I just went through the software. It's a very, very important tool in my arsenal to be able to effectively apply the knowledge that I've learned over the years into a successful system. So I think this is something that probably can be applied to pretty much anything here. When you have good knowledge and when you have it and you apply it with tools and a system, you're going to have success. And I think this formula can be applied to blood testing. Once you learn how to interpret blood test results from a functional perspective, so I don't want to come across as sort of a shameless infomercial, but I want to show you how you can get your hands on some knowledge. Also a very powerful tool that combined together will be very helpful for you. You know, in the past I focused on just doing training programs, which is really about imparting knowledge to you in the hope that you can take that knowledge and apply it in practice. But I realized that once I developed the software program, I needed to put together a system, and that's what I call my Functional Blood Chemistry University program. It's clear you need more than this knowledge. That's where I created Blood Chemistry University by combining the very best in online education, the very latest in analytical software. You have at your disposal an amazing system for creating long-lasting change in your patient's health and well-being. So this is Blood Chemistry University. This is where the knowledge and the tools come together. Basically what we do is I've recorded, the training experience happens within the university itself. I've recorded 12 training sessions. So you get access to all 12 of those, and you get the audio downloads and handouts. Also have some bonus presentations from leading experts, and also have access to a coaching archive. I love doing phone calls with my group, and when I do a phone call, answer questions, go through cases and that type of thing, I usually put the archive of that into the program. And finally, we have the software program. I just went through the report. There's just a ton of stuff in the software. You get to create custom profiles. You can schedule lab tests. There's a patient dashboard where you can quickly see all the results and the elements that are out of balance. We've got access to our clinical tools section. That's basically my book. It's totally incorporated into the software program. You can use US or standard international units, where the conversion tool allows you to convert between elements. We do free upgrades. So once you're in the system, you get free upgrades. I'm always working on new enhancements and adding in new features, so you'll get the advantages of those at no extra cost. So Blood Chemistry University provides you with everything you'll need to be successful. So that's my presentation today. I hope you found it useful, and I look forward to getting together with you again very soon.